Hello, my name is Alexandra Hall, and I'm a third-year psychology student. Today I'd like to talk to you about a behaviour modification intervention aimed at helping someone, or yourself, overcome a fear of public speaking. An effective intervention for this fear is called in vivo desensitization. This method involves gradually approaching or gradually being exposed to the fear-producing stimuli. Talking about a feared stimulus, especially talking about how to overcome a feared stimulus, may produce anxiety. So it's important for you or your client to recognize signs of anxiety. These include an increased heart rate, shaking, sweating, nausea, and even lightheadedness. It's also important for you to recognize that these feelings are completely physical. They are unpleasant bodily experiences created so that we will avoid the situation, which is just fine for situations that are threatening to our well-being, but not so much for day-to-day activities, like speaking to a group of people. The trick is, when we avoid a situation and hence avoid these feelings, the escape becomes reinforcing, so we're more likely to do that in the future. Relaxation techniques are free and relatively easy to learn or teach. Diaphragmatic breathing, or deep breathing, can be used to overcome the shallow, rapid breathing that usually accompanies anxiety. If you place your right hand on your upper chest and your left hand just over your belly button, you focus on your breathing rate. So close your eyes and take a deep breath in and count to 4, and then release. The aim of this technique is to feel the air being pulled deep into your lungs. It will slow your breathing down and help conquer feelings of anxiety. It may be helpful to model this technique to your client during the first use, just as I've done to you, and then prompt it in future uses. So verbally prompt the client to use it when they need it. The first stage in this intervention will involve creating a list of all the feared situations that client experiences. For example, talking to a group of 4 people, talking to a group of 50 people, or giving an oral presentation in class. The next stage would be to rank these fears from most fearful to least fearful, using a subjective discomfort scale. On this scale, 0 corresponds to no fear at all, or no anxiety produced by the event, and 100 corresponds to the most fear possible, or the most anxiety. So, for example, giving an oral presentation in class might correspond to about 90 on this scale, whereas talking to a group of 4 people in a social setting may correspond to about a 20 or 30. The next stage is to start progressing through these steps. So start working to overcome the fear in each of these steps. Start with the least fearful situation, so the situation that is rated the lowest on that scale. It might be an idea to write a speech and have the client present it to you in a therapy session until they feel comfortable. So repeat the speech until they have no anxiety associated with presenting it. You could introduce another person, so they're presenting the speech to 2 people then, and maybe the client can go home and practice it at home in groups of 3 people or 4 people with family and friends. Hopefully soon they'll be able to present a class speech without any anxiety associated. When the client can undertake a step with minimal anxiety, you then progress to the next step. However, at any stage, if the client does not feel comfortable to progress to the next step, or is unable to undertake a step that you're working on currently, you can always go back a step and focus on the one behind. This way, the client can build their confidence, you can continue to praise them and positively reinforce them, and build their confidence to overcome the next one. The last session in a behaviour modification intervention for a phobia would be focused on maintaining the progress. So you'd want to identify situations with the client where you think that they might be reluctant to employ the techniques that you've taught in these sessions. So identify high stress situations that the client may not feel comfortable with, and look at techniques that the client can employ when these situations arise. A follow-up session is always good, even if it's just a phone call, to make sure the client is still on the right track and not succumbing to the anxiety that they're feeling. Thank you.